A nursing SOAP note is a structured method for documenting patient care using a standardized format. Subjective, patients' reported symptoms. Objective, measurable clinical findings. Assessment, nurse's clinical judgment, plan. Nursing actions and interventions. This format ensures clear, concise, and standardized communication among healthcare providers regarding a patient's condition, progress, and treatment. Digitized assessments. Replace paper-based audits with digital tools for greater efficiency and accuracy. Standardized practices. Ensure consistency in note-taking across all healthcare providers. Error tracking. Identify and address documentation gaps and inconsistencies. Regulatory compliance. Maintain alignment with HIPAA, Joint Commission standards, and facility policies. Using eAuditor helps healthcare teams maintain comprehensive patient records while meeting documentation standards and improving care coordination. Review SOAP notes for completeness, clarity, and accuracy. Identify documentation gaps and inconsistencies. Ensure alignment with hospital policies and regulatory requirements. Select eAuditor checklist, include SOAP structure, evaluation components, assess legibility, completeness, and clinical relevance. Gather relevant data, access nursing records and previous SOAP notes. Review patient charts and facility documentation policies. Subjective. S. Verify patient complaints and medical history are clearly documented. Chief complaint and pain levels, symptom onset and duration, patient reported changes. Objective O. Confirm measurable clinical findings are properly recorded. Vital signs and physical assessments, lab results and diagnostic findings. Precise. Factual observations. Assessment A. Review if clinical judgment aligns with findings. Clear clinical interpretation, appropriate categorization, identification of risk factors. Plan P, verify treatment plans and interventions are documented. Medication administration details, follow-up actions, and patient education specific. Realistic action steps. Each component of the SOAP note must be evaluated for accuracy, clarity, and compliance with documentation best practices. Automated report generation eAuditor streamlines the assessment process by instantly generating comprehensive SOAP note assessment reports, including photos for visual documentation when needed, providing compliance ratings based on predetermined standards, adding detailed comments for clarity and improvement guidance, documentation, gap identification reports, highlight missing subjective data from patient interviews, incomplete assessments or clinical observations, vague care plans lacking specific interventions. Assign corrective actions, notify staff of documentation inconsistencies, implement mandatory training sessions, set deadlines for addressing identified issues, schedule follow-up assessments, conduct regular SOAP note audits, update documentation policies as needed, track improvement metrics over time, enhance staff training, provide ongoing education on effective documentation, reinforce legal and ethical requirements. Share best practice examples. The corrective action process ensures continuous improvement in SOAP note documentation practices and maintains high standards of patient care documentation. Regular documentation audits, perform monthly or quarterly assessments, track improvements over time, revise SOAP note templates to meet evolving clinical needs. Culture of excellence promote precise, patient-centered documentation. Recognize staff who consistently meet documentation standards. Use eAuditor to track recurring issues and address them proactively by digitizing assessments, automating reports, and tracking documentation errors. Healthcare facilities can improve clinical communication, enhance patient care, and efficiently meet documentation standards.